In hospice, we spend a lot of time normalizing the use of morphine and other opioids for comfort in the hospice patient. We hear all the time, they'll go to sleep and die. They're sensitive to pain medications. I don't want my mother to have morphine. There are many myths about morphine, and in this video, I will only talk about one, which is morphine hastens death. We hear all the time that someone knew somebody who came onto hospice, started morphine, and they died because of the morphine. The reality is, too often people come onto hospice too late. They are already in their transition or active phase of dying, and morphine is used to ease their symptoms in the dying process. And when they die, it feels like the morphine has killed them. This is a traumatic experience for people who truly believe this to be true and has happened to their loved one. The myth is that morphine has hastened their death. It is true morphine can make people sleepy, especially when they've not used it. But the reality is that the small doses used to manage distressing symptoms like pain or shortness of breath in the dying process are not enough to stop a person's breathing and kill them. It's just not happening. We say all the time, we are giving medications because they are dying. They are not dying because we're giving medications. When we hold a strong belief, which may be accurate or not, it takes an authentic conversation where people feel heard and seen in order to see our beliefs differently. It's important that patients, caregivers, and families express their worries and concerns about the use of morphine so that an honest conversation is had about specifically what those concerns are. People need to be fully heard before they can listen and properly be educated. And some of these concerns are not myths, but are valid worries that hospice should really know about. Have patience with your hospice team and yourself, and be willing to hear their reasons for offering morphine as a comfort measure in the dying process. You can ask us questions on our blog, the Hospice Care Plan, and you can get a copy of our booklet, the Hospice Care Plan, A Path to Comfort, that really helps guide families and caregivers effectively care for their loved one. And please visit our YouTube site, the Hospice Care Plan, and there you can find over 400 videos of care and symptom management. You can ask questions, like, and subscribe. Thank you.